If my spouse is in a nursing home and we need help paying for care, what will I have to live on if my spouse receives Medicaid?
If your spouse needs Medicaid, if you first have to qualify for Medicaid, and Medicaid kind of primarily operates on two fundamental questions, and one is what are the amount of the assets that you have, and what's the amount of the income. Now, assets are between the couple, so they're looked at jointly, but income is looked at by the individual whose name is on the check. So let's assume that the husband is in the nursing home. His whatever income that the couple has and that they're living on that has his name on it, generally like his Social Security payment or his pension payment, that's going to need to be used for his long-term care, even if we qualify for Medicaid. Medicaid is going to come in and provide the assistance or cover the gap between what his income is and what the cost of care is. As far as what's left for the community spouse to live on, it's going to be whatever their income was before, less his income. So probably a significant hit on the income. So that's why it's really important to to just not go pay out of your assets until all those assets are gone. It's really important to do some planning to try to preserve those assets and maximize those assets, because they're going to be spent and they're going to go away at some point in time, and we need to try to utilize those assets for the living expenses and care of the community spouse.